On episode 539 of the 40 Plus Fitness podcast, we meet Dr. Cami Haas and discuss his book, If Your Mouth Could Talk, an in-depth guide to oral health and its impact on your entire life. You can find the full show notes for this episode at 40plusfitnesspodcast.com/539. Have you decided you're ready to make a change? To reclaim your health and fitness? The 40 Plus Fitness podcast is here for you. Each week, we dive deep into health and fitness topics that affect those of us over 40. I'm Alan Meisner. I'm an NSAM certified personal trainer with specializations in corrective exercise, behavior change, and fitness nutrition, a FAI certified functional aging specialist, and an OTA Level 2 online trainer. I'm joined each week by our co-host, Rachel Everett. She is an NASM certified personal trainer and a RRCA Level 1 run coach. Let us be your coaches as you find your way on your health and fitness journey. All right? Let's go. If you know you can't sustain another year of sliding down the aging curve, weight gain, body aches and pain, no drive, if you're ready to see your energy and confidence go up, 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 and you want to build a sustainable lifestyle that helps you be the best you can be, then you should check out Be Fit for Task. 40plusfitness.com/BFFT. Inside BFFT, I work with you to develop the mindset needed to lose weight and keep it off, build up your fitness safely so you can be who you need to be, put together the right for you strategies and tactics, have accountability to stick with it, and create a sustainable, healthy lifestyle. I'll be like the headlights on your car and the rumple bumps on the side of the road to keep you on your road to wellness day or night. And at the end of our 6 weeks together, you'll have more energy, be stronger and healthier, and yes, you'll have lost weight. But more importantly, you'll have the skills and tools you need to keep going, to be fit for task, to live the life you're meant to live. Imagine how amazing that's going to feel. Apply at 40plusfitness.com/BFFT, and we'll get on a discovery call to make it happen. 40plusfitness.com/BFFT. Hey, Raz, how are things going?
Good. How are you today, Alan?
I'm a little frustrated, just a little.
Oh, dear. Oh, gosh. How come?
Okay. Now, not long ago, I guess it's been a little while now, we went through that pick the music for this podcast, right?
Oh, yeah. Mm-hmm.
And I went on a site where you were supposed to be able to get royalty-free, license-free music to play and use.
Mm-hmm.
Okay. And what I did, to be fair, I didn't have to because this site offers these things for free, is I went in and I donated on PayPal a little bit of money, not a lot, to all three of them. I said, if I'm considering your song, then I'll pay all three of you because I downloaded your song. And now, because I'm posting my podcast on YouTube, I'm getting copyright infringement letters from a company that works for the guy I bought the songs from or got the songs from.
Oh my gosh.
I've emailed him. I've tried to refute it. And the risk I have is, if I keep trying to refute it, then YouTube will just take my channel down.
Yeah.
And so it's one of those things where they're giving him the benefit of the doubt. And my only opportunity to really fight it is to go in with the death knell. I'm either going to win or I'm going to die.
Right.
And he's doing it, pinging every show now as it comes out. And they're going through and finding these. And obviously, on YouTube, there's billions of videos. So they're scrolling through those videos. They're finding that song in my show. And I get a nasty email once a week now, and I can go and refute it, but they almost immediately are just sitting there ready to say false. And they're not looking at the evidence I'm sending them because I show them that it's on a particular site. I can show them the licensing from that site. And I can show them the the PayPal receipt where I sent these guys money, this guy money. So I'm really frustrated. So here's what I'm going to ask. If anyone in the audience, I usually don't try to talk in the plural, but I know there's a lot of you out there. If any of you are musically inclined, maybe in a band or something, and you want to come up with something that I can use for a new theme song for the show, please get in contact with me. Okay. Alan at 40plusfitnesspodcast.com. It needs to be uplifting. It needs to be cool and vibey. You know me. You know where I'm at. You've listened to maybe some of the songs that I've used in the past and what got voted up this time, which I'd love to keep because it's what you wanted to listen to as an intro and an outro for the show. But I just don't want to keep putting up with this guy hitting it, because if at some point the podcast on YouTube could ever or would ever monetize, he's going to be the one monetizing it. So the whole of the rest of the podcast gets nothing because he's claimed this 30 seconds or so, or even 2 minutes or so of music that I got legitimately off of a share site.
Yeah.
He put it out there. I got his email. He got paid. And now he's trying to come after my revenue. Well, there is none.
Wow.
But if I were making revenue or ever
Right.
do monetize or am able ever to monetize that site, he's going to be the one that gets all of that. So I'm like, it's frustrating.
That's crazy.
Well, it is. And the fact that the guy's not responding in a fair way. I mean, I'm emailing. I have his email because I paid him on PayPal. I have his email. So I emailed him directly and he's not responding to me. So I'm going to send him a couple more emails, but if you are musically inclined, can play the different instruments, maybe put something together for me, then I'd love to feature a listener's music on the show, give you full credit for doing that for me. So if you can, just get in touch with me, Alan at 40plusfitnesspodcast.com, and let's connect and let's figure this. Let's make this a project. Let's have some fun with it. Okay?
Yeah, that would be awesome. Be great to have our own listeners' music. How cool is that?
Yeah. So hopefully we can work that out. I mean, there's a lot of you out there. The podcast gets about 5,000 to 6,000 downloads per episode. So I know some of you are really into music and good at music. So if you've got something for me, I want to hear from you.
Awesome. That sounds great.
How are things up there?
Great. Beautiful weather, beautiful time to be outside, enjoying the trail and getting ready to plant our garden, just having a good time this spring.
So the ground's not frozen anymore.
Not right now. No, it's actually pretty good. We're getting a lot of sunshine. The weather's warming up. We're just getting the soil ready because it is still definitely too early to plant. But yeah, we're just planning out our garden and getting ready to get moving. So loving it.
What does the almanac say?
Yeah, don't plant anything till the beginning of June.
Okay. Yeah. All right.
Better safe than sorry.
All right. Well, are you ready to have a conversation with Dr. Haas?
Yes.
Our guest today is a San Diego-based orthodontist and dentofacial orthopedist, author and founder of the Super Dentists and Howard Healthcare Academy. He is on the board of counselors at UCLA School of Dentistry, where he previously received his doctorate in dental surgery. He is a nationally recognized speaker and sought-after expert, focusing on oral health and its impact on overall health and emotional well-being. With no further ado, here's Dr. Cami Haas. Dr. Haas, welcome to 40 Plus Fitness.
Thanks for having me.
In over 6 years of doing this podcast, and this being episode 539 of the podcast, I've never had a dentist or orthodontics. We've never talked about oral health. And I'm like, so to see your book, I was really excited to get an opportunity to have this conversation with you because, we hear a lot about, well, if you have mouth disease or periodontal disease, then there's a higher probability you're going to have heart disease, and there's a connection there. So today we're going to kind of get into some of that.
Let's get into it.
Yeah, and then so I'm really excited about it because again, I think it's just one aspect of our health that's really, really important. And of course, when was the best time to plant a tree was 20 years ago. When was the best time? The second best time is right now. When was the best time for us to take care of our oral health? Well, it was when we were babies, but when is the second best time is what we can do right now. So
you got it.
Kind of where I want to go. The book is really good though. If you've got grandchildren or children and you want to make sure you're giving them the best opportunity for a healthy mouth, a healthy life, the book is really, really good about giving you that guidance and giving you the things you need. So I really appreciate this opportunity to have this conversation with you.
Likewise. Thank you so much for having me.
Now, the name of your book is If Your Mouth Could Talk, an in-depth guide to oral health and the impact on your entire life. And as I mentioned earlier, this is about what our mouth is doing for us or to us. And some of those things are, there's going to be a little bit of water under the road. I mean, onto the bridge. We're going to have to deal with that. But we are in a place where we can start taking control of our oral health. And this book gives you a lot of that. So thank you. Why you went through a lot of this in the book, and there were studies about, all these chronic diseases that we're dealing with: heart disease, Alzheimer's, cancers, on and on, diabetes, on and on and on. There's a link to our mouth, and not just what we're eating, because I think that might be part of it too, but there's a link to our mouth health and these other chronic diseases. Can you kind of go through a little bit of that and that connection and why that might be so?
Yes, of course. Again, thanks so much for having me. I'm so excited to be talking about this. So, like you said, you've been doing this for so many years, and I'm the first dentist really talking about oral health connection to the physical health and chronic diseases and longevity. And that's not surprising because, unfortunately, because how our teaching institutions were established 200 years ago, that dental schools and medical schools have always been separate. Over these last 2 centuries, we used to know it. The early Egyptians and the Greeks, they used to have they were well aware of the connection between oral health and physical health. In fact, they wanted to check someone if they were healthy. They would ask them to open their mouth. They would look at the mouth. They kind of had a good feeling for what was going on, beyond the mouth. But over the last 2 centuries, unfortunately, we've forgotten this because of that education process, and then insurances, they don't cover dentistry. And then we've been taught as a dentist, I'm a dentist, I'm an orthodontist and dentofacial orthopedist. As you know, my wife is a pediatric dentist. We have a very large group practice with oral surgeons and with general dentists and with hygienists and with all sorts of other specialties. And so I've had the pleasure, but also the experience of working with all these different specialties, seeing kids and adults and young and elderly go through oral health issues. And I think it was time that I put this together. So a few years ago, I actually first wanted to write this book about the oral connection to the physical health, the chronic diseases that you're mentioning, because that was I thought the biggest disconnection that people have, right? They really don't connect it together. And as you mentioned, more and more studies are coming out. If you ask me, call me, Dr. Hollis, what chronic disease connected to oral health? I'd tell you, let me just tell you the ones that I don't know yet, because almost everything else is, right? So it's easier just to, and more are found. Over the last 20, 30 years, we've had just a flood of information and clinical studies correlating oral health to almost everything, like you mentioned, many types of cancers and heart disease and, pregnancy complications and diabetes and Alzheimer's and dementia, all sorts of things. So there are two really main connections. It was a long answer to your question, but there are two primary connections. I want your listeners to think about this. Your mouth is the opening to your body. Think about this. If you had an infection on your arm, a big infection, the size of your mouth, or on your leg, that connection would be very easy to know that, oh my God, if I don't take care of this infection on my arm or leg, I may lose my arm or leg, or I may have chronic problems, right? I may have organ failures, I may die. That connection is very easy. But when you have an infection in the mouth, i.e. dental infection, cavities, or gum infection, periodontal disease, people don't connect those two things, which is really incredible. And again, my profession is to blame really as much for that, because we don't go around and educating people, because we don't get that education in schools. We're all learn how to fill cavities and straighten crooked teeth. So there are two ways primarily that your oral health impacts chronic disease. These two ways are: your mouth is filled with microbes. In fact, we have more microbes in our bodies than we have human cells. We have about 30 trillion human cells and somewhere around 100 trillion microbes. And our mouth is filled with billions of microbes, somewhere between 5 billion to 100 billion. So if you have an infection in the mouth, those bacteria or the toxins can enter the bloodstream. And where does the blood go? Everywhere. So it can go to the heart and cause a local infection, or cause systemic inflammation, go to the brain, the joints, anywhere in the brain, and then cause problems. Or the inflammation in the mouth in response to the bacteria can cause chronic inflammation that can cause also systemic health issues.
Now, in the mouth, one of the things that kind of came out of my reading your book was kind of an understanding that, we all kind of knew, well, we all know there's a gut microbiome. It's getting more and more press. That's the hot kid on the block right now. Take care of your gut, take care of your health. But our mouth actually has its own microbiome.
In fact, where do you think the gut microbiome comes from? The mouth.
Yeah.
Right? So this is such a wonderful question, by the way. So when a baby is born, and when the baby is in the womb, there's no microbes involved, right? The baby gets the first dose of its microbiome traveling through the birth canal. And that's why when babies have had, the moms have had natural vaginal birth, they just have a better mix of microbiome to begin with, right? And then they get more additional microbes through breastfeeding and, obviously passing between the parents and the siblings and all the caregivers and all and on. The first place that these microbes get seated is in the mouth. And every time we swallow, all those microbes, we're swallowing millions of microbes every time we're swallowing to our gut. And that's where the gut microbes come in. So you're 100% right. People have at least started talking about the gut microbiome and how important that is to our overall health. But I think the misconnection or disconnection again is where does the gut microbes come from? It's the oral microbiome, which is the collection of all the billions of microbes in your mouth. And so if you don't have a healthy oral microbiome, that whole ecosystem is out of balance. And then you get unhealthy gut microbiome and all of these everything in the body is connected to everything else. But unfortunately, because dentists and physicians, we have different worlds and we have our own specialties, we all forget this connection. And so you're 100% right. The microbiome, it's just our microbes has evolved alongside us for millions of years, and it's key to our survival and it's key to our health, to our immunity, to our digestive system, all sorts of things.
Now, for most of us, when we think about oral health, besides coming to visit someone like you on a regular basis, we're thinking about brushing our teeth, flossing, mouthwash, that type of thing.
Exactly.
But in many cases, what we're doing is actually causing more harm than good.
In many cases. In fact, you would think in the last 30 years, with all the advancements in science, technology, and medicine, our mouths should be healthiest ever, right? But actually, they're the unhealthiest ever. More than 50% of adults over age 30, by the way, these are CDC numbers, and more than 70% of people age 65 have gum disease. I think if we didn't do anything, we'd be in a better position than using anything oral health that we currently using. So I actually started my book with the first sentence of, this is not a book about brushing and flossing, because I really wanted to make sure that people, because I think that's all we are educated about when we go to the dentist. Just brush your teeth, floss your teeth, and you should be good to go, right? But I just told you that's just not the case. We're very unhealthy as a society, as you know. Unfortunately, as Americans, we do many things right, but our health is not one of them. And that's why I love being on podcasts like yours, because I feel like this is like our passion, yours and mine, to get this message out to everybody. And so we want to make sure that, we look at your oral health more than brushing and flossing. And like you said, let's take the mouthwash, which was an example that you said. Let me just give you this very simple. The most common mouthwashes that people use, first of all, they use it because they want to mask their bad breath. And where is this bad breath coming from? Is because you have terrible, poor oral health, gum disease, right? Again, if you had that infection on your arm that was starting to produce this terrible odor, you wouldn't just pour, like something that smells good over it, right? You would go take care of the infection. But what we do with our mouths, we use these very, very strong, potent antibacterial, antiseptic mouthwashes that literally on the bottle says kills 99.99% of germs twice a day. So let me ask you a question. If I told you, hey, I found the best cure for all the diseases, take these antibiotics twice a day indefinitely to prevent disease. This is going to kill 99.99% of the germs in your body. You would tell me, Kwame, you're crazy. I just told you gut microbiome is so critical to our health. But we do that in our mouth and we don't even think about it. I literally met a person 3 weeks ago that when I asked him, what do you use for oral health? Because he had just terrible oral health. And he said, I use this mouthwash that kills 99.99% of germs. I won't say the name on the podcast. And then on the other hand, he uses probiotics. So on one hand, he's trying to put billions of microbes back in his mouth. And when I told him, one of them is it's killing all the microbes and the other one is just full of microbes. He's like, he never really thought it through just because he just saw the ad for one and then the other and just like, hey, I'm going to try to do everything I can. So our oral health is at worst it's ever been. And it's partially due to diet. It's partially because our diets has just changed so much since the agricultural revolution and then the industrial revolution. Everything's processed foods and nothing close to what it was intended to do. But partially is because of the oral care products that we're using. It's just a terrible marketplace right now.
Yeah. And they do a really good job of marketing. I had read a story one time about why our toothpaste foams.
Yeah,
And it foams because that showed people it was working.
exactly.
And so it wasn't that it was valuable. It was just that became the famous tagline for that product.
100%. In fact, the two things that companies do manufacture oral care, the so-called oral care products companies with toothpaste and mouthwash to make you think it's doing something. There are two things. One, they make them foam, like you said, because the more foam, you feel like you must be cleaning, doing something, right? In fact, too much foam is terrible because you can't even see what you're doing anymore. A very little bit of foam using a very natural foaming, like Kiaha or something, not like SLS or something that's like this, like really damaging your soft tissue. It could be toxic when you swallow it, all those things, which most manufacturers use. But so that's not the foam because they're just trying to tell you that they're working, which is actually doing the exact opposite. The other trick they use is they put a very strong mint flavor, like something like peppermint oil, essential oil, which is terrible. Essential oils is another thing that they may have other properties, but they don't belong in your mouth. And so a very common one is peppermint oil, which is really very dangerous for children, in addition to being terrible to the microbiome because it's a very potent antibacterial essential oil. But what it does, you feel like you have to foam, and now your mouth smells like this minty for at least 30 minutes. So it makes you feel like it's doing something. So those are the two things that I think you should just put aside when you're thinking about what oral care products you want to use for yourself or your children.
Yeah. Now, one place where I think it kind of surprised me, I guess, for a lack of a better word, was seeing how much the mouth can interrupt our sleep. So sleep disordered breathing. And I think many of us would know that because if we're over 40, I would say a large percentage of us probably snore. Some people even have sleep apnea, or something you actually introduced me to now is upper airway resistance syndrome. Mm-hmm. Can we talk about those? Because, for a lot of folks, they're going to go to the doctor and they may have a sleep issue. They may get diagnosed, go to a sleep clinic, and the doctor's going to say lose weight. But some of this is already kind of a little bit done because our mouth is already where it's going to be. But so can you talk about how the mouth, the teeth, and then how that all relaxes our sleep? Yeah.
Great question. In fact, if you notice, the longest chapter in my book is about the breathing and the sleeping chapter, because I think you're right. People don't like, what is a dentist talking about sleep? I don't understand. So here's what it is. So when I talk about oral health, I'm talking about two different areas. One is the microbial health. And my goal is to educate the public. Let's move from killing the microbes and disinfecting our mouth and sterilizing our mouth to cleaning, protecting, and supplementing our mouth, right? That's really what I want to be from the microbial perspective. We want to protect and, nurture our microbial community that's in our mouth, called the oral microbiome, which leads to our gut microbiome and all of that. So we can talk about that at some point later again. But the other side of it is the growth and development of the mouth. Now, contrary to what most people think, your mouth is not just this little area where you have these teeth, right? Your upper jaw, called the maxilla, goes all the way under your eyes. Is the bones of the under your eyes is still part of the maxilla. It's part of your cheekbones. It forms the bones of the nasal cavity. And then the lower jaw, of course, houses the tongue and is the rest of your face. So other than your forehead and your eyes, everything else in your face is your mouth. And so your mouth impacts your airway. Of course, it's the upper jaw with the nose and the lower jaw with the tongue. And so it has a dramatic impact on your breathing, right? And during the day, of course, breathing, I don't have to tell you, oxygen is critical for everything, right? It's the number one nutrient that we need. It's even more critical in a child, especially the first 5 years, because their brain are like exploding, goes from a 20-25% size, the maximum size at birth, to 90% of its size by age 5. So during those 5 years, the growth and development of the mouth is critical for their airway, breathing, oxygen intake, and sleep. What happens during sleep is if you don't have good airways, if you're not breathing correctly, that gets even worse at night because your muscles relax. So the tongue goes and blocks the airway. And as you mentioned, half of the people snore, and which means really we're all affected because either snore yourself or your partner snores, which keeps you up at night, and many other problems. And snoring, even though we always joke about it, when I meet my friends, that's the number one thing that they joke about with their partner. They always blame the other partner, of course. It's never them that they snore. But snoring, it's the first step of this downhill thing. First of all, it could be a sign that you already have something, like you said, UARS or sleep apnea, which they're all at the range at this between, when you say sleep disorder breathing, which is really all the breathing issues that cause you not to have a good night's sleep. It starts with snoring, which basically is a vibration of your soft tissues, with your nose and your mouth, because you're supposed to breathe with your nose. Now, why am I talking about the nose, even though I'm a dentist? Is because your palate, which is the roof of your mouth, is also the floor of your nose. It's the same bone. So when your mouth is small, your airway is small. You can't breathe through your nose, right? When your mouth is small, your tongue doesn't sit against the palate, so it goes and blocks your airway, and you can't breathe at night. So that really, the dentist community should be leading the charge against sleep apnea and this sleep disorders. And we should work hand in hand with sleep physicians, right? They can make the diagnosis. We can make the dental appliances that help with breathing. And as you very well said it, the best time to do this is when you have a child and they have airway breathing issues. And that's why you should see a pediatric dentist when your baby is born immediately, because it literally starts from even health of pregnancy impacts these things. But really the latest you should see a pediatric dentist is right at birth or before the baby teeth are coming in, because let's just say your baby has a tongue tie. Now the tongue doesn't move around. That means it doesn't sit against the palate, which means the baby can swallow, they can breastfeed. Then they're going to start breathing through their mouth, called mouth breathing. When you start breathing through your mouth, the nasal airway doesn't get stimulated, so the mouth and the nose don't grow correctly. And so, as you can see, these little things start becoming really big problems over time. During childhood, because your mouth the bones have not formed and they're still growing and the sutures have not fused, as orthodontists, as pediatric dentists, we can actually fix problems, right? We can actually permanently fix it. We expand the upper jaw, we bring the lower jaw forward, and we permanently fix airway issues. In adults like me and you, we can still fix it, but it usually involves wearing something up to bed, right? Yes, you can do some surgical treatments, but I'm not a big fan of it for majority of the cases. But some of the common things is obviously we can lose weight or become more healthier in general. But if those things are not working, then you need to wear an oral device that kind of keeps your jaw and your mouth open during nighttime so you can sleep better. Or you can wear a CPAP, those devices. And some of those things, of course, it's different for everybody. There are like 100 devices that are out there that could work differently for different people. And so people need to visit their dentist and or sleep physician and find something, because it doesn't matter what you do, you need to breathe. I need to breathe. As we said, you can't really joke around with oxygen intake. Every single cell in your body will suffocate if you're not breathing correctly, which again, it gets exaggerated when we're sleeping.
Yeah. And the reason I brought this up is sleep is so fundamental to our overall well-being and health. 100%. If you're not sleeping well, you can eat well, you can exercise, you can do pretty much everything else you want.
Not going to have a good quality.
You're still not going to be optimized. No. So if you are struggling with snoring or sleep apnea, go see your dentist and your sleep specialist and have some conversations, because I think that's something we'll all want to look at, because it's like I said, like you said, it's happening. There's so many of us are snoring, very common. So,
and because of the obesity epidemic, this has gone worse and worse, right, in the last 20 years. By the way, I just did want to say that not every dentist, unfortunately, and every physician is airway focused or sleep trained. It's just a small fraction of them, unfortunately, are. It is a requirement, not a requirement, but in 2017, the American Dental Association recommended that every dentist does a sleep screening or airway screening during every dental exam, but we just don't, because there's one thing for them to recommend, is one thing for the dentist to go back to school and actually get trained and educated about this. So when you do go to your dentist, make sure that they are trained and they know about sleep and airway.
Now, I'll admit I'm like everybody else, and so I'm out there and I'm like, I want to do better for my health. So I'm going into this health food store, and they've got all this different stuff, toothpaste, mouthwash, and all that.
I know about
but this is but this is a health store. So I'm like in there, and they have this clay, so it's basically dirt, is what it was, and they flavored it cinnamon. which I don't know if that was good or bad. But in your book, you go through and talk about some of the ingredients that we're going to see in our dental care products. Like you called one of them the mouth-rageous ingredients, and then the mouth-standing ingredients. Kind of plays on building words. But so some of these are really bad for us, and we probably shouldn't have them in our healthcare. Our oral care, and some are probably really good for us. Can you kind of go through and talk about some of the good ones and some of the bad ones?
I'm happy to do it. Like you said, I know when I go to the grocery store and I see that toothpaste aisle, I'm like, how is a person supposed to make that decision? We as dentists, I'm on the board of UCLA Dental School, and we get little to no education, almost none in dental school about oral care products. You would think your dentist knows what's in a toothpaste. Our education and knowledge of it is just as much as you. You'd be surprised to know. We just know, like, okay, maybe fluoride. I've asked, 20 dentists, what's in a toothpaste? Fluoride. What else is there? I don't know. How does the fluoride work? I don't know. So, and if you don't want to use fluoride, what else do you use? I don't know. You go to a natural health store, and you're like, I don't know. Maybe this is just good. And the people who make it, they have no idea because they're not oral health experts. And so, of course, people don't know what to use. Dentists don't know what to use. So the manufacturers just kind of do their own thing. And then people end up buying something that has the boldest claim or has the nicest packaging, or for the kids has the best flavoring. Nothing based on science and fact and clinical research, and something that's safe and effective. Those two things are critical. For kids, playfulness is even important because we want to make sure they build positive associations. But safe and effective. These are the two things that are always, like anything we put in our bodies, we want to make sure it's safe and effective. Food, like you said, I think many of us are educated about reading what's in our food, or educating about what's, healthy food, what's organic, what's natural, what's whole food, what's fermented, all of those things. But when it comes to oral care products, because nobody has this information, I thought I got to put this in the book so people have a reference, so what's mouth-standing, good, what's mouth-rageous, terrible, then you should never put it. By the way, what other food do you put in your mouth twice a day, every single day, other than your toothpaste and mouthwash? Nothing, right? So this is such an important thing, right? Because and let me just tell you, with the toothpaste and the mouthwash, all the oral care products that you put in your mouth, they get absorbed through your mouth, through the mucosa, through the mucous membranes. And then, of course, it goes to the blood, goes everywhere in your brain. Of course, we swallow some of it. There's no way that you're not going to swallow. So that's why these ingredients in your oral care products are so important, not just for the health of your mouth, but for the health of your body. So let's go over a couple of the very important ones. One is fluoride. Let's just start with the most controversial toothpaste ingredient or mouthwash ingredient called fluoride. Okay, so fluoride is a drug, is a medication. It's FDA regulated one. It's currently in the United States the only compound that it's approved for anti-cavity. By the way, in other countries, there's another ingredient which is my favorite, and I'll tell you about it in just a second. So fluoride. Fluoride, how does it work? Your enamel, your teeth are made out of these. By the way, your teeth are alive. And that's another thing that I want everybody to remember, because I think we treat the mouth like we have to just have these 20 or 30 dead objects in our mouth that we need to sterilize them and polish them from the outside twice a day and get it to the dentist so they can really polish it good twice a year. But our mouth is alive. Our teeth are alive. They have internal cells and nervous system and all of that. And so we want to give it nutrients and everything. So fluoride is a drug. In fact, anything that comes with fluoride, any toothpaste or mouthwash, FDA has a warning sign on it. You're mandated by putting that says, warning, keep it away from children under age 6, something like this, by the way. If you swallow it over what we need to use it for toothpaste, you need to call the nearest poison control center. This is an FDA regulation. So, of course, that means that if you fluoride at high levels, it's toxic to your body, right? This is not me saying it. Now, fluoride does work. When the way you get cavities, when you eat something acidic or sugary, your pH of the mouth, which is the acidity of the mouth, which is really something important that everybody should learn about, it's usually at neutral around 7, but then it drops when you eat something. It drops when it reaches around 5.5. Those enamel crystals called hydroxyapatite. 97% of your enamel is made of this mineral. It's a calcium phosphate mineral called hydroxyapatite. A little bit of it dissolves away in that acidic environment into the saliva. When then the saliva bathes the teeth after 30 minutes or so, then these minerals get deposited back into the teeth called remineralization of the teeth. So when there's a balance between this demineralization and remineralization, you don't get a cavity. But if you eat too much bad foods, quote unquote, or if you eat it too frequently, there is too much demineralization, not enough remineralization, you get a cavity. Okay. And so what fluoride does, fluoride mixes with hydroxyapatite, forms this new mineral called fluorapatite. And that fluorapatite is stronger to acidic attacks because it doesn't get dissolved until the acid reaches 4.5. And the 4.5 to 5.5 difference is a big difference. And that's why fluoride works. So there's definitely fluoride works. But because it has all these potential toxicities, I don't recommend it for majority of the patients, especially with younger children, because dental fluorosis, which is one of the side effects of too much fluoride, usually happens in kids, and because it's such a common thing in our society now. So if you have young children and they're not prone to getting cavities, and they're not a high risk child, which means they don't have genetic problems, don't have, again, genetic things are just 10% of the situation. So for majority of the kids, you can replace that fluoride. Don't just remove the fluoride and don't put anything, but you can replace it with something else called hydroxyapatite, which is the synthetic version of what's already naturally in your teeth. And that is around since 1970s. It's been tested and tested and tested and tested. It's completely safe, and it remineralizes it just as good or better than fluoride. In fact, it's been already approved in Canada since 2015 for anti-cavity. In Japan, they've been using it for about 30 years. And so in US, I'm hoping FDA is going to catch up with some of these other countries. We're going to hopefully approve it. But right now, it's already available in some products. And so don't just remove fluoride, replace it with this. Now, if you're a high-risk person, which means you get cavities, you have a dry mouth, your pH is low, you use whatever. I go through this more in detail in my book. You should use some fluoride. And so you can also even mix it with hydroxyapatite, because also for older people, you don't swallow as much, your swallowing reflexes that develop. So again, I would reserve fluoride for maybe 20% of the population, older people and higher risk people. And for younger people and lower risk people, I would use hydroxyapatite, specifically nano hydroxyapatite, which mimics the natural enamel, which naturally whitens the teeth. It remineralizes the teeth. It reduces sensitivity. It even buffers the teeth against cavities and acidic attacks.
Okay,
that's one ingredient. Yeah. You asked me for but as you can see, I'm very passionate.
No, that's good. No, it is. It's great. There was another one that was kind of surprising to me. Was when you got into some of the sugar alcohols that, as we're trying to, obviously you don't want to brush your teeth with sugar, but we like that. We like that bubblegum flavor, right?
Yeah.
So we want something a little sweeter, something a little bit more of a taste. And so it's going to be sweetened.
Yes.
But not all of the sugar alcohols are the same.
Exactly. Not all sugars are the same, right? By the way, I hate this name, sugar alcohol. I wish somebody would have, because by the way, it has no sugar and no alcohol. I just want to repeat this. No sugar and no alcohol in these sugar alcohols. So I don't know, whoever came up with this name is just terrible, terrible naming. So they are just like everything else. If I ask you, hey, is food good or bad? You say, well, call me which food? There are foods that are fantastic, there are foods that are terrible. Is mouthwash good or bad? There are mouthwashes that are fantastic. They're alkalizing mouthwashes. They use really great ingredients. But the ones that you see, there are these fluorescent colors or neon colors, and you can't keep them away. They're terrible. And it's the same thing with sugar alcohols. There are cheaper ones like sorbitol, which is very common. And the only reason they're used because they're very cheap. They're not as good because the bacteria that causes cavity, they can still ferment and use that as food, and then they can excrete acid and cause cavity. So my two favorite sugar alcohols, again, I hate that name, that are naturally present in fruits are xylitol and erythritol. And those both have been really, especially xylitol. Xylitol has been extensively studied. There was a study that just came out that looked at over 200 studies on xylitol and concluded that it acts like a prebiotics. And just quickly, the difference between probiotics and prebiotics is bacteria. Prebiotics is food for the microbes. So prebiotics are compounds that naturally is produced. Like, for example, in breast milk, the third most common ingredients is prebiotics already. So nature already does this, right? And so we want to mimic nature. And so prebiotics, xylitol, inulin is another great probiotics that it doesn't kill the microbes in your mouth. It feeds the good bacteria and starves the bad ones. But also xylitol and erythritol, like you mentioned, they have great taste, because at the end of the day, we want to make sure that we encourage people to use it. And that way it gives them a great flavor. At the same time, It provides the food for the good microbes. It also raises the pH because it stimulates salivary glands to produce saliva. So it works in different ways to make sure that we keep our mouths healthy.
Great. And there's a lot in the book on how to go about doing this. Now you have a product, don't you? A product line, Super Mouth, or
yeah. So we're launching this company called Super Mouth, and this is why. Again, like you said, we go to the grocery store and we have no idea what to buy for ourselves, what to buy for our kids. We go to the dentist doesn't know what to do. So how do we do this? What's the solution? The solution is this. You would go on this website, supermouth.com, starting July 31st, and you would just say, hey, my name is this is my age, and these are some of my risk factors. We ask just 5 or 6 questions per house family member. And then we become your proactive oral care advisors. So every 3 months, every 6 months, every family member will get a box, customized oral care products for that individual. That based on SUPER acronym, SUPER. Everything will be super. They're completely safe for S. They're unified. They work together as a system. So you don't get this person that I met 3 weeks ago that uses antibiotics and then uses probiotics at the same time, right? Their P is playful. Again, we want to build positive associations with your oral care. They're based on superheroes and villains in movies and augmented reality and storytelling. They're effective, E, super, because at the end of the day, if they're not working, right? Yeah. I just talked to a good friend of mine. We were having breakfast this morning, and his wife, when she was pregnant, she got 7 cavities after pregnancy because she avoided quote unquote conventional oral care products. But they weren't effective. So it was terrible. So if we're going to remove something like fluoride, let's just say during pregnancy, well, what are you going to replace it with? So our oral care products are completely safe and effective during pregnancy and early childhood and beyond. And at the end of the R stands for reputable, because we want you to come to us, dental experts, oral health experts, for your information, not Google or social media and random people that you have zero to little knowledge about oral health.
Yeah, or the tagline kills 99.9%.
Exactly.
Dr. Haas, I define wellness as being the healthiest, fittest, and happiest you can be. What are 3 strategies or tactics to get and stay well?
I love it. I would just say, I think the 3 things is because people know about eating healthy. Like if I ask the average person, I'm sure you would agree, hey, how do you stay healthy? I think the average person would say, well, eat healthy and exercise. Those are the 2 messages that we've always heard. But my job and my passion and my goal is to add a 3rd one to that. And the 3rd one is to take care of your mouth. Take care of your mouth from the microbial perspective, and take care of your mouth from the growth and development perspective, from airway perspective. So that would be my passion. Eat healthy, exercise daily, and take care of your mouth.
Awesome. Well, they say the smile is a gateway to the soul. So I have to agree with you there. If someone wanted to learn more about you, learn more about your book, If Your Mouth Could Talk, where would you like for me to send them?
So you can buy my book from your favorite bookstore, Barnes & Noble, Amazon, but you can also go to our specific website about the book, themouthbook.com. My dental practice is also thesuperdentists.com. So those are a few places that you can get information about me, my practice, and the book.
Cool. You can go to 40plusfitnesspodcast.com/539, and I'll be sure to have links there. Dr. Haas, thank you so much for being a part of 40 Plus Fitness.
Thank you very much. It's been a pleasure.
Welcome back, Raz.
Hey, Alan. Well, wait a minute. I just got to say what an interesting conversation this was. When you first said you were going to have a dentist on, I was like, what were we going to learn about that? But we learned a lot. And I actually learned that the bacteria in our mouth is very important, and I'm killing it with my mouthwash. I had no idea.
Yeah, well, most of the products that we use, consumer products, they have a really good marketing company that's going to tell you what you need to know. And what you need to know is that you need a sterile mouth.
Yeah.
And so they, and it sounds reasonable. It's like when, someone tells you that you have a microbiome on your skin, that there's billions, trillions maybe of bacteria crawling all over your skin, it gives you the heebie-jeebies,
It does. It really does.
You're sitting there looking at your arm. It's like, where are those little
Ooh.
critters? Yeah.
Yikes.
I don't want to touch anybody because they got the heebie-jeebies. But so the point being is that, yeah, we have these microbiomes. A lot of this stuff we're still figuring out. How do these interact with each other? How do they survive together? And what are we doing that's harming them? Because we antibiotics, don't get me wrong, they are one of the best medical inventions ever, but they are like a nuclear bomb.
Exactly.
Taking out everything. And we're making better nukes and better antibiotics as we get more, bodies get resistant to the easy ones. And then, those bugs are now resistant and we have to go harder and we have to go heavier and it's a bigger bomb and a bigger bomb. Yeah. And, then your ability to regrow that is extremely limited because these bugs in many cases don't even exist anymore. Everybody's killed them. And there's none, so it's not like you get in the soil. We don't do that,
No.
Don't let your kid get their hands dirty. Oh my God, don't put your hand in your mouth,
Yeah.
We were eating mud pies,
Yep. Yep. And drinking out of the garden hose.
Yeah. We should be dead. But no, it made us healthier. Who knew?
Yeah.
And so, there are microbiomes throughout the body, and they're there as a part of our immune system. They're there to help us stay healthy. And, mouthwash, it's a good marketing term. It sounds like you're doing the right thing. I want a good, fresh, clean mouth.
Yeah.
And you're over cleaning it is effectively the answer.
Yeah, that was a big surprise. Although I'm not surprised about fluoride. I think a lot of people know that a lot of times our city water is fluorinated. Then you get the fluorine in the toothpaste. And if you're over time taking in too much fluoride, that can become a problem. So it was interesting that he had an alternative for that.
Yeah, there are some alternatives and some things. Xylitol is one. It's a sugar alcohol. Again, you don't have to swallow it. You just need it on your teeth. Right. And the other was this product I had not heard of before, but nanohydroxyapatite. And they call it NanoHap for short. You can look it up. It's available. It's going to be in his product. So realize he's going to be selling dental products too. So probably toothpaste and things like that, because these toxins like fluoride and whatnot, they're a cumulative thing. And so if you're having your kid brush their teeth twice a day and they're swallowing too much fluoride and getting it in their water, there's this buildup and a potential. So it's his opinion that children should not be using fluoride in their water. That said, in their toothpaste. But that said, if they're prone to cavities, then they need something to protect the enamel. So the two things you look for are, how do we reduce the acidity and how do we help the teeth build back stronger the way fluoride would? And so there are these alternatives, and it's worth looking into to help your child not have that much fluoride, probably too much. And so having your kid drink filtered water, because I think some of these filters can remove the fluoride from the water. Right. And then you can look at the toothpaste and maybe take some there. But if you're going to do that and they need something to help with the hardening of the teeth, then you're going to look at it. And the other thing that we didn't talk about, because we're an adult show, we're not an adult, but we're talking about us and being healthy over 40. But yes, with children, grandchildren, things like that, if they're not taking care of their baby teeth, they're going to have problems with their adult teeth. And I know I always thought, well, they're going to lose it, so who cares? It does matter. The mouth affects your health, but the mouth, as you're growing up, affects what your mouth is going to be when you get older.
Sure.
There's zero reason for anyone to have teeth extraction, except for the fact that it was a kid. We didn't take care of little problems that later became big problems. So your mouth is not big enough to handle your wisdom teeth. I'm not much of a talker other than being on a podcast, but I have my wisdom teeth because I have a big enough mouth that it was never a problem.
Lucky.
But it's part of that's genetic, but the other part of it is just, taking care of your teeth when you're young.
Sure.
I
Yep.
never did anything silly other than smash my face and
Oh,
kill
geez.
one of my teeth. So I have,
Oh.
have my issues, but
Mhm.
not to the point where I didn't have enough mouth for the
Sure.
teeth that were going to come in.
Well, healthy habits need to start at a young age. And if we can teach our children and grandchildren how to care for their teeth, then they'll have healthier habits as adolescents and as young adults.
But then on our side, yes, the best time for us to have taken care of our teeth were when we were children. The best
Yes.
time you can take care of your teeth right now.
Yes.
That's what we've got. So
Yeah.
if you're having some issues with periodontitis, or that's what I pronounce right, but if you're having some issues, it's worth getting it looked into because there is a correlation there. There is a heart disease and some of these other lifestyle diseases. There's a correlation. The reason I wanted a dentist on was predominantly for the heart disease. So some of this was also eye-opening to me
Yeah.
because I was thinking, wow, they've tied this to diabetes, to cancers, to Alzheimer's disease, all these different lifestyle. We're now starting to realize are lifestyle diseases. So while the cause might not be the dental issues, there's an association. And so if we're not taking care of our mouth, we're probably not taking care of our health. So it's a red flag at the very least for you to say, okay, why am I having these dental problems? What can I do about it? And is this a lifestyle thing that's causing this versus, because, there's people that brush their teeth twice a day, 3 times a day.
Oh, yeah.
And they still have issues with this. And so it's, there is a care regimen. There is a hygiene. I mean, that's in his book. He's really, really good about walking you through a proper dental hygiene thing. And it includes getting the acidity of your mouth down, which can be the choice of foods. It can be a mouth spray or something like that. But it's getting that acidity down. And then the second aspect of it is just making sure that you have strong, healthy enamel in your teeth, that your teeth are living things and they need to be cared for. You can think of them like plants. You have to take care of them or they're going to go away. And so, that's really why I wanted to have someone on like him, because it's really the first, what I'd say, good book or book out there where I was like, we could talk about health in relation to dental health and our overall health and what that relationship is. But this is a care manual. I mean, literally this will teach you how to take care of your teeth, your children's teeth, if they'll listen to you, and your grandchildren's teeth. So it's a really good manual for you to go through, get an understanding of the relationships and the things that are good for you, build a good hygiene, and you'll have a better mouth.
That sounds great. I think I need to take a look at that hygiene because my mind is blown about the whole 99% killing all the bacteria in your mouth as being a problem. So I'd like to see what he's got for us to take better care of our mouths and therefore better care of our health. That sounds really interesting.
Well, the name of the book is it's Dr. Cami Haas, and the name of the book is If Your Mouth Could Talk. So
perfect.
All right, Rachel, I'll talk to you next week.
Sounds great. Take care, Alan.
Okay, bye.
Bye-bye.
Next time on the 40 Plus Fitness podcast, we discuss the 3 simple tactics to lose your spare tire over 40. Until then, have a happy and healthy week.